With Thanksgiving now in the rearview mirror, local medical experts are warning about what the COVID-19 road ahead of us could look like. This afternoon, the Department of Health released 2 days worth of data. Health officials did not release numbers on Thursday because of the holiday. ODH says it saw more than 17,000 new cases over the past 2 days. Now, this brings our state total to just about 400,000. 72 new deaths and 474 new hospitalizations are also being reported again. That's over the last 2 days.
Tonight, we're hearing from an expert about a wave of new infections in Canada following their holiday early last month. NBC4's Matthew Herchick joins us live now from Columbus. And Matthew, is there anything we can learn from their experience?
Well, Audrey, like you mentioned, Canada had a significant increase in new infections following their Thanksgiving just a little over a month ago. While a few residents we talked to today said they did their part to stay safe over the holiday, one expert told me they expect to see a similar surge here. With Thanksgiving having now come and gone,
we usually have about 40 people or so, a lot of kids, my grandparents. This year, we just kept it to our immediate family.
Concern over the holiday's potential impact is still very much at the head of the table.
My biggest worry hasn't always been about myself, but those that I could infect.
Medical experts warned for weeks that large holiday gatherings could become super spreader events. Now their fears could soon be reality.
You know, frankly, I kind of anticipate another surge too. I mean, look at the trend.
I was very concerned once we hit over 100,000 cases a day, and now we're way beyond that, and it wouldn't surprise me at all if we start hitting the 200,000 a day case. We're very close to it.
After Canada's Thanksgiving last month, experts say we may only have to look as far as our neighbors to the north for an idea of what the coming weeks may look like.
They had a huge increase in not only their COVID-19 positivity rate, but also, too, patients being hospitalized.
Canada recorded just 975 cases nationwide on October 12th, a number that grew to more than 5,500 just 1 month from their celebration.
They actually did fewer testing, and although they were doing less testing, their positivity rate really went up.
A similar effect could see healthcare systems in Central Ohio become even more overwhelmed than they already are, ultimately leading to staff shortages and forcing difficult decisions from hospital leadership.
The worst case scenario is that we get too many patients in the hospital and non-COVID type care may have to be trimmed back.
And Dr. Gassado told me that these healthcare workers, they're parts of their community. So a higher positivity rate in the community means a higher positivity rate in healthcare, which, like I said, creates challenges with staffing. And he said is already creating concern among fatigue and burnout for the staff that is healthy enough to work. Local for you in Columbus, Matthew Herchick, NBC4.